Started.
Yeah. Okay. So uh, first, like they said, they will give universal cues in the before the short clinical station or the extended clinical station. So within 5 to 6 minutes, including that reviewing, like 4 minute, there will be a review of the cues, whether it's a picture or audio or video. And after that 4 minute, we need to do the examination. And that examination, we need to describe the full technique, interpretation, and our differential and the management plan. So, for example, this wheelchair child, let's say if there is a, in the picture, there is a wheelchair child. And if they give us command like do motor neurological examination, so what command we should give in a way that we complete this examination in 5 minutes. So we need to do one by one, like for example, we'll do each one of us will try to give our individual command. So at least we'll have an idea like which one we need to practice more. So like if I am a candidate and if there is a child, this child picture is given to me, wheelchair. So I will just uh, start just record this, do the timing also, put the timer also, so we come to know like you have to stop me in the 5 minute and correct me like where which component I should not speak or I should not verbalize. So let's start for the practice for 5 minutes. Okay, and somebody has to be a role player who which will give me command and the cues. Okay, hello. So Sandeep, you will give me the that's wheelchair patient cues if I start the examination on this child.
Can you see now? Picture.
It's a Google. I can see only the Google. I cannot see the picture.
Started screen share.
No, no, I cannot see.
No.
No.
Okay. No problem.
So let's consider this child is a quadriplegic CP for simplicity of the first or the beginning of the case. So they gave this picture, and this child is quadriplegic CP or diplegic. If you have a ready cue, you can make the case, and I will start.
Yes, okay.
Okay. So findings you will give me accordingly, whatever you thought in your mind. So I will start. They all other members they will be like examiner, and each one of us will do this exercise. So we'll come to know which one is better. Okay. So shall we set the timer and start? You set the timer for 5 minutes. In 5 minutes, I should complete my examination, and then the remaining discussion part will do also. Okay, so Sandeep, you are ready?
Start.
Okay, fine. So hello, good morning. I am Dr. Hiren, one of the candidate today. Child name is, let's say, John. So I'm washing my hand or I'm gelling my hand and uh, making introducing myself and seeking permission from the parents for examination of the John, and also make a rapport with the John. Hi John, how are you doing? Will make John at ease. and we'll look around the room whether there is any extra support, wheelchair, or
Child is on
any.
wheelchair.
Yeah, so there is a wheelchair I can see. I would like to confirm whether it's a electric or the manual
Motorized.
wheelchair, motorized wheelchair. Okay. Now I'm going to ask the mom, is there any, is John have any pain? Is there any sore, anywhere sore?
No.
Okay. Can John walk?
No.
Okay. I would like to expose the John. Mom, can you help to try to uh, sleeve the trousers up to the level of the thigh so I can examine both the legs.
Okay.
Okay, and now I'm making inspection. I'm seeing, looking for any wasting, fasciculation, any a scar mark in both the legs.
There is generalized wasting.
Okay. Meanwhile, I'm also talking to the John. How are you doing, John? What is your favorite food? What did you eat today? I'm just assessing his mentality as well as the general, like whether he's following voice command or not. He's talking to me. John is talking to me and
Yes, yes,
understanding it.
he's talking. Stress.
Okay. Okay. And after that, I'm looking for the tone. John, uh, can you keep, like, I request to do examination in the couch, but if
Mm-hmm.
examiner says, okay, just
Mm-hmm.
examine.
Okay, you can examine on the wheelchair only.
Okay, I will see, examine the tone by making the passive movement. I will explain the John that I'm going to make a move of both the leg. If you
Mm-hmm.
feel pain, me, and I will check at the level of the knee, like by rolling or just making a passive movement both the legs at the level of knee and ankle.
No, tone
Tone
is
is
increased both the limbs in
both side.
thigh as well as leg muscles.
Okay. And after that, I will check the power by commanding him, like uh, raise your leg at the level of thigh for looking for flexor, extension, abductor, and adductor group,
Mm-hmm.
and asking him to not let me push leg down,
Over.
not push up, and I will be repeating the same in both the leg. So how is
Power
the
is
power?
less than grade 3 in both the limbs.
Okay, now I'm going to look the power in the both the the leg at the level of the knee by same mechanism by pushing my hand against my pressure and uh, in the front and in the back.
Okay, it's
So,
again less than 3.
okay, and checking same at the ankle level. And now after that, I'm going to check the reflex with the telling. I'm going to tap the knee tendon with this hammer. If it hurts,
Reflex.
stop me.
Reflex is
So
brisk. Both the knee.
this, okay. And I'm going to check the same at the level of ankle as well as the plantar, whether
Um,
checking for any
Ankle
brisk
jerk is brisk. Clonus also.
and bonus also there, and Babinski also
Levinsky
upward,
positive.
positive. Okay. All right. So now I would also like to check the tone of the hand by asking, like, making the passive movement of hand at the level of shoulder and elbow and
5 minutes.
okay.
Actually, it's 6 minutes. No, then why 5 minutes you want?
If we can do it 5 minutes, it is better.
Continue
So
with 6 minutes. Better, no? Finish it.
fine. Okay, so I'm checking the tone in the both the hands at the
Mm-hmm.
three levels: shoulder, elbow, and wrist, and looking for hypertonia or hypo. What is the finding?
Tone in upper limb is also increased, but less as compared to the lower limbs.
Okay, and I'm checking the power also in both the hands by asking him to make both the hands like chicken wing and like a boxing posture, and checking in the both adductor, flexor, and extension group.
Power is around grade 3.
Okay, now I'm going to have a look on the back for the scar or scoliosis. I'm going to have a look on the head for any shunt, and I'm going to also have a look on the nappy and the abdominal area for any scar or shunt.
Stop.
And also I'm going to have a
Finish.
look
Time
at,
finished.
okay, fine. So this is a 6 minute, what I could do just motor sensation still I did not make, I could not do the sensation, and cerebellar also I could not make, right?
Yes.
So the
Actually,
other
the
things,
command of motor examination will not be there. There will be examine the lower limb or examine the upper limb, because it's they know it's very difficult to finish the examine, this verbalize and finish in 6 minutes.
yes, right. So now what we will do, like, correct me which point, we know this case, I mean, the presentation part, I think most of us knows, like, yes, but this verbalization is, I feel it is more difficult. Let's say if I have to put this finding together, I would say, yes, I examined this John, 10-year-old child who looks average for his weight, and I would like to plot his measures into the appropriate chart. And on examination, he's in the wheelchair, and he has increased tone in both the legs. His power 3 by 5 in both the legs, and both the hands also. He has hypertonia, and his reflexes are brisk. And there is no VP shunt, or there is no scoliosis or no scar. All these findings are consistent with the upper motor neuron type of lesion, most likely quadriplegic cerebral palsy. So this is the presentation. And then after that, there will be, let's say, discussion of what are the differentials and the management and all. But the point here now, I will stop here and just each one of us will do the same case. How you will do?
Rather repeating, let's discuss how we can do it actually. If anybody knows the scheme of
Yeah.
doing it, that will be better. Like if somebody has attended any course or any
Hello.
particular
Yeah, Dr.
meeting.
Sandeep.
Yes.
Yes, yes.
I'm Dr. Satish.
Yes, yes, Dr. Satish. How are you? Nice to see
Yeah,
you.
yeah, yeah. Actually, I'm on duty. I was listening, so I felt actually. Can I say for
Yeah, yeah, yeah.
my
Open.
experience? Yeah. Okay. So actually, I gave one clinical exam at UK, and I got the same case in just what last October. Okay. Hello.
Yeah,
Yeah,
yeah.
continue. We can hearing. We're listening.
You can hear?
Yeah, we can
Yes.
hear you
Continue.
properly.
Yeah, and then actually with this case, this was a around a toddler, like 5 6 years old girl with on a wheelchair, and the examiner asked me to do a motor examination of neurological examination of the lower limbs. Okay,
Okay.
and yeah, it went good actually, but I don't know. What I did was I just introduced. It was a very friendly girl, and I handshake and all started very well. And from the we started from the spine, grossing, as doctor he said, like I did the same thing in the lower limbs. I think we need to look at the spine even. Yeah.
Yeah, we no, we check in the end in the back also with the
Yeah,
spine.
yeah, back, yeah, spines, and yeah, examining both upper and lower limbs is very difficult. I think they don't give us And this scenario, this was a case of cerebral dysplasia. And she asked me to short history, what questions you like to ask to the mothers. This some examiner can at last she asked me C questions at the time of it. So I asked about the prematurity or not, like it was born at term or born before date. And the on the remark I got like, you missed to examine the hip. I don't know how to examine the hip because the child was very comfortably sitting on the wheelchair, and I feel very uncomfortable to undress the full. I just asked him her to lift the clothes, but didn't ask to remove it. Uh, all of it.
Maybe they were
So
expecting you to make the child lie down on the couch and then examine.
uh,
That could
yeah,
be.
maybe.
Yeah,
Yeah,
they may
yeah.
be
And
expecting you
then
to lie down the child on
uh,
the couch,
uh,
an
uh,
extension.
and then the diagnosis was correct. I got like 6 or 7. I forgot. I was searching for my feedback to post, so but I missed it. I have to search again. Otherwise, it was okay. It's neuro case. What I feel is neuro case. We practice a lot, and it's not that difficult in the exam. Actually, the cardiac cases are gave me a lot of trouble.
Okay. Okay, see
Mhm.
here
Yeah,
now
it's
with the
okay.
new pattern, Dr. Hiren, like
Yeah,
what is
yeah,
the,
yeah,
yeah,
yeah, yeah.
the new pattern we have to verbalize. We don't have to examine. So Hiren, actually,
Uh-huh.
initially you spent more time in like describing the things, I feel.
Mhm.
So,
Mhm.
like, what will be like initially, like, do we have to say, like, I will introduce myself, I will gel my hand, all these things, initial part? I don't know. I have not attended any course for that. Maybe anybody else, like Dr. Hiba, might be knowing how to start with this.
Yeah. Um, yeah, you have to, like Dr. Hen said, okay, I have to introduce myself to the child and the carer, okay, or the caregiver. And while I'm just washing my hands or rubbing my hand with a sanitizer, I trying to make a rapport with the child to assess the speech and the mentality. Okay, then I will take a permission from the mother to examine the child, and I will also take a permission from the child himself, as if he's cooperative and he's just reacting with me. I have to take a permission from the child and ask him if he has any pain anywhere in the body. Okay, and I will, to assess the gait, I will ask the mother if the child can move even with support. No, he cannot move. It's okay, let's go on and examine the lower limb. I will take the permission from the examiner. Do you like to examine to examine him on the wheelchair or just lay him down on the couch? If he told me no, examine him on the wheelchair, I will ask the mother to turn up the trouser, okay, until above the level of the knee. And if he wear just a panty or a short under this trouser, I will take off the trouser because I want to see if there is any scar in the hip area, if there any wasting in the muscle of the thigh or the calf muscles. So I have to expose him fully. But first, I have to ask the mother if he's just wearing anything below this trouser or not. Then,
Dr. Hiba,
yeah.
sorry to interrupt. Sorry to interrupt. So, what you are saying is absolutely correct. Why don't you let take the same child and do in the 5 minute? Whatever the command you are saying is absolutely correct. I have no, I mean, concern against what you are saying. 100% right. But take this as a case, as a universal cue given to you. Now it is your turn, and
Okay.
you start. Okay, I will change finding slightly dependent Q. I will change little bit. Okay,
Okay, okay.
so that will make you in a right perspective to to verbalize.
Okay,
Okay,
no worries. Okay.
so let's say I will set the timer. Child name is Jenica. Jenica is a 12-year-old girl,
Mhm.
and she's on the wheelchair, and your task is to examine upper limb examination. Okay,
Sorry, upper limb or lower limb?
upper limb examination.
Upper limb examination. Okay,
Yes.
okay.
Okay.
Uh, First, I will just
I,
creating.
once you're ready, you collect your thought, and then I will put timer.
Okay,
Ready?
okay, ready. Okay.
Okay, you can start.
I will grade the mother and the child, introduce myself to them, and while I'm just try to making a rapport with the child. Hi Jessica, how are you? To assess her speech or mentality, I'm just rubbing my hand with sanitizer gel. How is her speech and her mentality? Is it okay reacting with me?
Yes, yes. She is talking with you. I'm fine, doctor, and
Okay,
she's communicating with you.
and she's just answered my question properly. Like
Yes.
she got my point. Okay, I'm just searching in the surrounding. Is there anything else rather than the wheelchair that she's sit on?
No, there is nothing other than the wheelchair.
Anything obvious? Any abnormal features, facial features, microcephalic? I cannot see anything. She's in
No,
glasses.
there is no microcephaly,
Okay, no glasses.
no glasses.
Okay, I will just ask the mother, take her permission and the child. I will examine you, Jessica, if you don't mind. Just I want you to turn up your shirt to examine you while I'm examining you. Is that okay with you?
Yes.
Do you have any pain elsewhere in the body?
No.
Okay, great. Okay, please, Jenica, please, can you just turn up your hands?
Yeah, she turned up the hands.
She can do it.
Yes.
Okay, and she can do it against resistance. If I'm just pushing her down, her hands down, and forearm, she can just resist me.
Yes, she can resist you. Yes, but at which level you are checking? Hand is a
Yeah, I will check the arm and the forearm and also the shoulder.
okay.
Is
So
that okay? And she can resist me. She can shrug her shoulder.
yeah, she can shrug her shoulder. She can resist at the level of um, forearm and hand also, but at the shoulder you feel there is a power uh, 3/5.
Okay, okay, great. Okay, and I will ask her, Jenica, please, can you just, I will examine the muscles of the hand. I will ask her to make a fist over my finger and try keep tight on my finger. She can do it?
Make a fist on your finger.
Yeah, yeah. Just make a fist on my finger and try to push her to just make it tight and resist me.
Yeah, she can do it. Yes.
And for I will just ask her to abduct her fingers, okay, and try to resist my hand while I'm just making to tight her fingers. She try to resist me, or there is no power.
Uh, Power at the level of finger is okay. She can do it, but you feel is not strong. Let's say 4 by 5.
Okay, okay. Then I will examine the reflexes. Okay, I will start with the precordialis. On the precordialis, I will just tap on the level of the rest. Okay, if there's any hypertonia or hyperreflexia, I'm sorry,
Decrease reflex.
at the precordialis. Okay, I will just examine the reflex of the deltoid. I will tap on the level of the deltoid tendon. What's about the reflex?
Yeah, the reflex also you feel it's reduced.
Okay, and at the level, I will examine the triceps um, reflex. I will tap on the triceps tendon. Is there any contraction of the muscle?
No, reduced. It is reduced there also.
For sure, I will do it bilaterally and I will make a comparison. Is it equal bilaterally? Reduced bilateral?
Yes, reduced bilaterally.
Okay, so I will just ask her to examine the sensation. I will ask her to close her eyes, and once she feel a touch, she give me that yes, I feel it. Okay, I will make examine the sensation bilaterally on the level of the forearm and the level of the arm.
Both side sensations normal.
It's intact bilateral. Okay, okay. I will ask her to do a coordination. Okay, so I will ask her to just point to my finger with her finger. Just touch my finger. Is it there is
Yeah.
she can do it.
She can do it, but she has little bit difficulty in doing this, and your times is up. 6 minute finish.
Okay, I would like to complete my examination by examine the cranial nerve affection. Okay, and also I'd like to examine the back for any scars or scoliosis or any deformity. And also for to complete the neurological examination in the lower limb.
Okay, so uh, what's your impression for this child? What do you
Yeah,
think the problem has?
yeah, I found that she's a 10-year-old girl, wheelchaired. She cannot do any movement even with support. There is hypotonia and hyporeflexia on both upper limb, intact sensation, and coordination cannot be assessed truly because of the hypotonia. Maybe she cannot do it as a movement because of the hypotonia in the lower limb.
Mhm.
Uh, I'm my impression. It's a case of lower motor neural lesion, um, making making hypotonia or in both upper limb, and maybe there is also hypotonia in the lower limb, but lower limb not be fully not examined. So it may be a case of spinal muscular atrophy.
Mhm.
Um, if it's a spinal muscular atrophy, it will be there will be a fasciculation in the tongue. So I will ask her to stick out the tongue and see if there is any fasciculations in the tongue.
Okay, there is no fasciculation in the tongue.
Uh, could be atonic cerebral palsy, a case of atonic cerebral palsy, or a case of mixed cerebral palsy. There will be central hypotonia. Mm.
So in mixed cerebral palsy, you will have decreased reflexes.
No. The reflexes will be there will be a central hypotonia and the peripheral hyperreflexia in the limbs. Also, it will be associated with some tremors or dystonia.
What is your other differential? Other possibility?
Other differential, it could be myopathy, okay, but like um, facioscapulohumeral atrophy.
Okay. Okay. So now it's a 9 minute total time finish. Okay. So 6 minutes, what you could do, the task was upper limb, and what do you feel?
I feel that it's really hard. It's difficult. Sometimes I have the idea in my mind, but I cannot express it.
Yes, true. So this is the issue. Like we could not verbalize it nicely. Uh, because nobody of us, I think it, even though in the meeting they are saying like you have to say, somebody I think asked in the webinars, and the one who was giving the talk in the webinar said, yes, you have to describe all the group of the muscle while checking tone. You have to check the power also at the all muscle groups and like this. But is it possible practically? Like when we ask, you feel that difficulty in executing this command or giving this instruction, right?
Yeah, yeah, it's really hard. But
Yes.
yeah,
I
anyone
will tell
talk?
you, I give you the case. This was like,
Hiren,
proximal myopathy, lower motor neuron type of lesion.
Hiren,
That was right.
Hiren.
Yes.
Let's
Yes.
rejoin. Only 2 minutes remaining. Okay. The
Okay.
same link
Okay.
you join. Okay.